Hello, this is Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bengaluru. Many people, that is males, they come to me complaining of low libido. Now, what is libido? Libido is a sexual desire. So when they complain of low libido, what they mean is their sexual desire has decreased. Now, what are the causes of low libido in men? Low libido could be an isolated low libido where the sexual desire comes down but other functions of the body are normal. But low libido could also be a part of a generalized problem wherein there is a decreased sexual desire, there is a decreased energy levels and motivation levels of the individual. What are the causes of low libido in men? It could be because of psychological reasons. It could be because of systemic problem, like for example, poor nutrition, a thyroid problem, or some hormone related problem, or a low libido which is isolated without other problems could solely be because of decreased testosterone levels in the male. So by carrying out a few tests, we'll be able to know the cause for low libido and treat it accordingly. Let me add here that low libido is not the same as erectile dysfunction. In erectile dysfunction, the erection function of the penis is decreased, whereas in low libido, it is a desire which comes down. So there are two different problems, but they could be interconnected. What are the treatment options for low libido? Low libido, as I already discussed, could be because of psychological reasons. For example, a person may have a lot of work-related pressure, financial pressure, personal problems, or some people inherently are anxious, etc. So in that case, awareness of a psyche of the individual and counseling will help in decreasing the anxiety levels of the person, and that may increase the libido. It also could be because of poor nutrition, generalized problem, some hormone problems like thyroid, etc., in which case after investigation we substitute these decreased hormone levels and the libido improves. The third cause for decreased libido is isolated testosterone or sex hormone deficiency, in which case it is detected by blood test, and this can be treated by supplementing testosterone levels in the body either by injection or by tablet or by gels. So low libido treatment can be done successfully after identifying the cause.